Assalamu alaikum everyone. Today we're gonna talk about the eighth nerve and more specifically half part of the eighth nerve, that's the cochlear nerve. First of all, I was so sorry about some mistake that I did in our previous lesson. If you watched our the video that the watched the nervous trigeminus, I have changed the function of the two nucleus. First one is the principal nucleus, second one is spinal nucleus. I provide information about the temperature and pain. Information is direct to the principal nucleus. Sorry, that's not correct. It's direct to spinal nucleus, and the touching sensation is direct to the principal nucleus. Sorry for that. If you didn't watch this video yet, please try to understand by this way, not as in the video. Okay, we will initiate our lesson. That's cochlear nerve, and that's the structure that relates to the otolaryngologist, and this part is related to the neuropathologist. Yeah, and I'm going to initiate our lesson by a little bit physiology and the anatomy of the inner and middle and outer ear, and look at that. And that's tympanic membrane, and it receives sounds from the environment, and it conducts the impulses to the inner ear via three bones. They are stapes, incus, and malleus. Okay, and as the impulses conducted to the inner ear is accepted via the vestibular window. Vestibular window directs the vibration to the perilymphatic duct. Perilymphatic duct, more specifically scala vestibuli, and the moving of the vibration is finally reached the cochlear window. Okay, and this movement of the fluid, this vibration of the fluid, can cause some kind of generating impulses of the inner ear. Okay, and I shall talk that the louder voices can be accepted there, and the lower noises can be accepted there. Okay, and this is a section of this part of the inner ear, and that is scala vestibuli, as I mentioned above, and scala tympani, and the cochlear duct in the green color, cochlear duct. And there is difference, some kind of ion concentration between these two kind of fluids, and the main part of the inner ear is this part. This part is responsible for generating action potentials according to the sound. Okay, now look at that, and that's some kind of part of the inner ear, and when it vibrates, it can cause some kind of generating action potentials. These receptors, this hearing receptors. Okay, and after generating the impulses, they conduct the receptors to the cerebrum. Okay, now look at that, and there is a fluid, and both of fluids and the lymphatic duct and perilymphatic duct is connected with subarachnoid space. That's filled with the cerebrospinal fluid. Okay, now another information is there is auditory tube. Auditory tube, its main function is regulating the pressure in the middle ear and the outer part. Okay, when the soldier is shouting, they try to open their mouth. By this way, they try to keep the balance, the pressure between the inner ear and the outer space. Okay, now this brief information about anatomy and physiology of the cochlear nerve, and this part is devoted to the neural connections of the cochlear nerve fibers. Okay. Now that's spiral ganglion, and they are the first neuron of the cochlear nerve. They receive the impulses from the cochlea and direct to the cerebrum. Okay. Now when they enter the cerebrum, this nerve is entered to the cerebrum in the cerebropontine angle. Okay, cerebral low pontine angle. They enter to the brainstem. As soon as entering the brainstem, they can be divided into two parts. First part is direct to the dorsal cochlear nucleus. Second part is ventral cochlear nucleus, and between them located inferior cerebellar peduncle. Okay. Now, the cochlear, arriving to the hemispheres, the cochlear nerve don't spend 3 neurons, but they spend 4 or 6 neurons. There's so many synapses located between the hemispheres and the spiral ganglion. After exiting from the dorsal and ventral cochlear nucleus, they direct to the different parts of the brainstem. Most of them direct to the dorsal nucleus of the trapezoid body and the superior alveolar nucleus, and most of them direct to the nucleus of the trapezoid body. And their fibers direct to the inferior colliculus in two parts, ipsilateral and contralateral. So lesions located in this part, the right part of the lateral lemniscus, couldn't cause any total loss of the hearing ability. Okay, and these fibers that's direct to the inferior colliculus from the ipsilateral part can maintain some kind of function of the listening. Okay, and now after getting the inferior colliculus, they direct to the thalamus, and more specifically medial genicular body of the thalamus. And as soon as reaching there, they direct to the hemispheres, more specifically transverse temporal guards. Okay, now in the transverse temporal guards, the sounds, the information that reach to the hemisphere is analyzed according to its frequency or the type of the word, for example, book or teacher or people. Okay, as soon as listening these words, we try to analyze and shape in our mind. Okay, and when some kind of damage occurs this part, the sensory aphasia may occur. The patient couldn't analyze, couldn't imagine the sound that they are hearing. Okay, now, and there is some kind of physiological part, I should mention that, and some parts of the hemispheres is responsible for specific frequency voices. For example, this part is responsible for louder noises, for example, until the 20,000 hertz frequency, and this part of the temporal lobe is responsible for lower noises. Okay, and that's physiology. Now, I try to explain briefly the connection of the spiral ganglion and the hemispheres, but I provide information necessary parts. Okay, now I'm going to talk about now the examination of the listening ability of the cochlear nerve. Okay, there is two types of deafness. First one is conductive, second one is sensory. In the conductive deafness, the lesion located there, and in the sensory deafness, lesion located there or there. Okay, now we have two tests. First one is Weber, Rine, and second one is Weber. By Rine test, we ask the patient, are you listening? By Camerton, by vibrating the Camerton, we put this part of the processus mastoideus and ask the patient, are you listening? Yeah. When the patient, no, I'm stopped listening, and after that, they put the Camerton there. And are you listening? Yeah. And if the patient answered like this, this is normal. This is normal function of the ear. Okay, and the conduction of the bone is lower than the conduction of the air. That's normal. And in the negative test of the Rine, when you ring the Camerton and put the processus mastoideus, and the patient is listening, and when I stopped listening, and after that you put the camera there, and the patient provide information. No, I'm not listening, and that is the conductive loss, conductive hearing loss. Okay, because the air couldn't pass through the bones. Okay, now that's the Rina test, and our second test is Weber test. In the Weber test, we ring the camera and put this part of the head, and the patient can, if the patient listen equally, that's normal. That's normal, and if the patient says that the information that I'm listening in the louder this part, and it means that then this part, if they provide information, I'm listening louder this part than this part, and it means that that's conductive lesion. Conductive lesion. In conductive lesion, the patient indicates the lesion part, but when you put there and the patient says that I'm not listening well this part, and I'm listening well by this part, this side, and you can say that in this part the sensory hearing loss and this part is normal, and there is two different parts of the tests, and all of the information that's beneficial for you is all for today, and I'm going to say so sorry one more time for my mistake that I did in our previous lessons, that most specifically for the lessons that I watched for nervous trigeminus. Thanks for listening and watching, and if you have any offers or recommendations or complaints, we are always ready to receive from you in our comment part of our YouTube channel. Take care yourself.